Good afternoon. Welcome back. This is Faith. It is great honor to be attending this live surgery as a moderator. So we are now broadcasting live at Samsung Dentium Center in Seoul. So the operator of today's live surgery is Dr. Young-geun Hyun, who is representative of Periodontal Dental Clinic. He is also adjunct professor at the Department of Prosthodontics in KU Medical Center. Please feel free to leave a comment and ask some questions during this seminar. So today we'll discuss the lower full mouth flapless implantation using pin guide technique with narrow ridge implant. So here we have patient information of today's live surgery. The patient, who is 77 years old male, has come to the clinic with his chief complaint of his lower dental bridge being loosened. Taking past dental history, it shows that he had severe caries on tooth number 41, 42, 43, 44, 45, and 32 and 34, which have been developed into root cavities. And present illness is confirmed as hyperlipidemia. So this panoramic X-ray shows that the patient got root rest on tooth number 43, 44, and 45 and 34. There is periapical radiolucency on tooth number 41, 42, 43, 32, and 34, which indicates apical lesion. We can see that mandible shows moderate alveolar bone loss. So this is a clinical photo showing that there is not much tooth tissue preserved. And also we can see the perp exposure of root canal on tooth number 41, 42, and 32 and 33. So therefore, today's surgery plan is to put the 6 implants on tooth number 41, 42, 43, 44, 45, and 32 and 34. Immediate implant placement will be performed on tooth number 45 and 32. Implant would be placed on 35, 36, 46 area using Flapless technique. Obviously, pin guide kit and Dentium bright tissue level implant would be utilized. And the simple pin guide kit invented by Dr. Young-geun and Dentium will be helpful for the dentists who search for optimal surgical outcome. The pin guide kit gives the information of width of bone as well as shape of arch. The kit is composed of 3 types of pin in accordance of the angle: straight, 15-degree angle, and 25-degree angle. The pin is inserted right below the bone periosteum. When using surgical guide, utilizing computer-aided design and computer-aided manufacturing, CAD/CAM, there might be hindrance on surgical field of view. But pin guide is very efficient for clear field of view. Besides, there's no need of full thickness mucoperiosteal flap elevation. So what is pin guide system? As you can see, there are 2 pins. One is on buccal side of bone and the other is on lingual side. We can only see the two pins above soft tissue. The interval between two pins means the width of bone, and the angle formed by two pins means the shape of bone. So this is the picture of the bright tissue level implant. And this bright tissue level implant is such a good choice for simple surgical procedure. So this is machined as double thread, which allows more bone implant contact area, also known as BIC. And tissue level implant enables easy implant placement and better primary stability. Soft tissue level implant has an advantage of preserving alveolar bone due to the effect of minimal bone exposure. And this is the product Osteon 3 collagen. It is such a good material for bone graft. So this collagen is moldable to various shape, which allows it to be easily inserted on the defect site. The material maintains the bone volume and ensures implants to stay securely in place. So we are now move on to similar case. So in order to put our current patient in context, now I'm going to present a similar case with a different patient so that you can see a similar surgical process. So we took a facial photo of front and side view of the patient. You can see that the corner of mouth is turned downward, which makes sad or stubborn impression. The patient has a tendency of mandibular prognathism. So once MCJ, also known as mucogingival junction, labeling was done, the pins were inserted buccally and lingually. So X-ray picture on the right was taken to check if the pins were placed in right order. And CT scan was taken and it was vertically sliced. On anterior area, it shows converged pattern of bone. On the other hand, posterior area shows diverged pattern of the bone. 15-degree angled pin is inserted on lingual side of anterior area. And 25-degree angled pin is inserted on posterior part. And drilling was performed on anterior bone. Drilling angulation was formed on the buccal side pin. At first, point, also known as pilot drill, was used to make indentation. Then, Lindman drill was used consequently for further site preparation. Here it shows implant was inserted in accordance of central line. The left picture shows that the osteotum was used for the purpose of crestal sinus floor elevation approach. The right picture shows that the implant was placed on the lifted sinus floor. So this is the final image of implantation with bright tissue level implant. So for the tooth number 13, 21, and 23, 3.0 diameter and 11 millimeter length implant were placed. And 3.5 millimeter diameter and 11 millimeter length of implant was for tooth number 11 and 15. And we used 4.0 diameter with 9 millimeter length for tooth number 25 and 26. The good thing is that the patient can wear temporary denture very easily. And it is easy to handle, and this non-submerged healing doesn't require secondary surgery. Moreover, the plastic cap on the tissue level implant helps to relieve loading stress on implant. So the CT scan confirms that the implant placement was precisely executed in between two bone plates, even though there was no flap elevation involved. So this is photo taken after final fixed prostheses were delivered. We can see that the upper lip support is achieved after rehabilitation. Obviously, facial appearance has been restored, and the patient was satisfied with his experience. And this is the X-ray of final prosthesis. There we have pin-guided implants were placed in predictive position. So now we are going to see the surgery. So he is using mandibular extraction forceps to pull out the tooth 34. And there were a lot of periodontal abscess. So curettage should be needed. So straight pin is inserted on the buccal side. So for the tooth number 41 and 42, he decided not to extract to check the midline. And also with this information, he can determine the position and angulation of the implant placement. So still the straight pins are inserted on the buccal side of the edentulous site. So now the pin is inserted on the lingual side of the arch. And for the tooth number 33, he intentionally leaves it for the purpose to be restored with endodontic treatment and crown placement. So with the aid of the pins, you can see the outline of the bone more clearly. So now pilot drill is being used on tooth number 32. So drilling pathway is determined in accordance of the lingual inclination. So he usually uses the pilot drill to make an initial hole. So he is still using the same drill, pilot drill, for the rest part of the bone. So now he's switching the drill to the 2.5 Lindemann drill. So now the drilling sequence is 2.5 Lindemann drill. And now direct anesthesia is being injected on the site. So he usually administer the direct anesthesia for the purpose of reducing the bleeding. So Lindemann drill is used for more enlargement of osteotomy. And I believe the drill he is using is the 3.0 TL drill. TL twist drill. So again, I guess the patient has some pain, so he's injecting the anesthesia on the surrounding site. And now he switched the drill to the 2.8 Lindemann drill. So I guess it's third time of administering the infiltrative anesthesia. I guess he switched to drill 3.5 twist drill this moment. And the good thing about the pin is that it can suggest a potential pathway where the drill could be slided on the slope surface. So he keeps doing the drilling action to get the desired drilling pathway. And it's probably the 4.0 twist drill. So we can see that he's continuing the drilling sequence. Yep, so I guess the drilling just reached the final preparation. Now it's time for implant placement. So 3.0 diameter and 11 millimeter length is placed on tooth number 32. And he's now rechatting to tighten down the screw. And I just want to say that the inserted implant is the bright tissue level implant from the Dentium Korea, and it is a appropriate implant for flapless surgery. So 4.0 diameter and 9 millimeter length on tooth number 35. So we can see that the diameter gets wider and length gets shorter this time. So now for the tooth number 44, 4.0 diameter with 9 millimeter length of implant is inserted. Again, he is using torque wrench to apply more specific torque. So for the site of tooth number 45, 4.0 diameter with 9 millimeter length of implant is placed. And it's the same size as we used in tooth number 44. So the size of implant is a 4.0 millimeter diameter with 9 millimeter length of implant is placed on tooth number 46. And the good thing about the TL implant is that the interface between TL implant and gingiva is little, so it can inhibit the inflammatory response very efficiently. So he's doing drilling with 4.0 twist drill before final preparation, final placement. So that's 4.0 twist drill just used. And for tooth number 36, 4.5 diameter and 9 millimeter of length of dentium tissue implant was just inserted. So again, it's the step to use the torque wrench. So it's the action of applying like more torque for more fixation. So he's taking out all the pins he inserted. So I guess he's now clenching the surgical side with the saline from the high-speed handpiece. So he is extracting the rest of the root rest. So now he is just adding the bone powder from osteoin collagen. So now it is just compacted into the socket. So this bone powder soaked with fresh blood is now placed on the rest of the socket. So we can see that we can still do the bone graft on the occasion of the flapless surgery. So Dr. Younggun is finishing the surgery, so X-ray and CBCT would be taken to check if the implants were placed in right order. So now we're back in the review session. So left picture is a clinical photo of pre-operation. So root rests with poor prognosis were extracted and flapless surgery was performed. And the result is shown on the right picture. For this patient, he used interrupted figure of 8 and crisscross suture. Crisscross suture is a suture method variation of continuous matrix suture that pulls overlying flap to the extracted socket. So this is a pre-op panoramic view, and we can see some of root rest still remained on the alveolar bone. And there we have post-op panoramic view. This indicates that the implantation was successful as it lined up nicely. On tooth number 46, 35, and 36, flapless implantation was done, whereas on tooth number 45, 44, and 32, immediate implantation was done. Again, tooth number 33 was intentionally remained for the purpose of preserving the amount of alveolar bone. So likewise, CT scan can confirm that the implant is placed on the position where he designed. We can say that the pin guide surgery reduced the time for producing template and improve efficiency. So we are now entering the Q&A session. So I would like to address a question that some of you might have. A common question is, what is the tip for placing bright tissue level implant? And a critical consideration one must make is the depth in which the implant is inserted. As the procedure suggests, the surgeon must insert the implant below the gingival level at a depth deeper than 1.8 millimeter. That means the neck of the implant platform should be at the same level as the top of the crestal bone. So that concludes the presentation for today. So thank you for joining us the live surgery tonight. So I'm very looking forward to seeing you all the next time on December 2nd. So thank you again.